Hi, Dr. Windisch again from Sparks Pediatric and Adolescent Medicine. Welcome to our educational program for parents. Please remember that these videos are not intended to replace visits to your physician. If you have questions or concerns, we would like to see you. We're happy to see you here in our office, area code 775-359-7111. The topic of the day's video is vitamins for children. This was a topic that was posed to me by one of my patients, and it's created some confusion for people over the years because our recommendations have changed. So we're going to emphasize young children and infants and early adolescents, not so much late adolescents, but we'll talk a little bit about that. In years past, the recommendation was unless you had a dark-skinned patient living in areas where they didn't get a lot of sunlight in the winter, you didn't need to supplement vitamins at all. And we've come to realize that most Americans are actually some degree of vitamin D deficient. And there's a lot of guesses as to why we have these low levels of vitamin D suddenly showing up in patients in spite of drinking milk that's all been supplemented with vitamin D, but they're just guesses. So I'm not going to get into why we think that's happening, but we know that it is happening. So about a year ago, 2000, is currently 2010, so I think it was 2009, it might have been 2008 now. The American Academy of Pediatrics revised its recommendations on vitamins and recommended that for children who were receiving less than, I'd have to go back and look at the technical data, but I think it was less than 32 ounces of formula a day, because the formula is all vitamin D supplemented, they receive 400 international units of vitamin D daily. And this represented essentially a doubling of the vitamin D requirement recommendations. What this then translates into is any child who's not exclusively formula fed, and for all older children they should be on some form of vitamin supplement. And realistically any vitamin supplement will do. So in the infants, polyvisol, trivisol are more than sufficient. As the children become older, if you need to go on a fluoride supplement as well, here in the state of Nevada, outside of Clark County we need fluoride supplements. We can use polyviflor and triviflor to get the vitamin D as well as the fluoride for the children. And then as the children no longer need fluoride supplements here in northern Nevada, we transition them back over to chewable vitamins. And we recommend chewable vitamins as the kids get older. Any adult swallowable will be fine. If you have a male child, they don't need the iron supplementation, so staying away from the women's vitamins is probably a good idea for male children. As far as your older adolescent children, some other recommendations that we have for females is to increase the calcium in their diet. An additional 500 to 1,000 milligrams a day is not a bad idea. And some folate in the diet as well for all women of childbearing age. And that starts with early adolescence and goes through menopause, is highly recommended as well. The folate can be obtained from most multivitamin complexes. Calcium you can obtain from a source as simple as Tums or Oscal. I hope this has been of help for you and helps to clarify these new recommendations for vitamins for your children. We want to keep everybody healthy. We want to prevent bad bones and some of the other things that we're now seeing associated with low vitamin D levels, including heart attack and multiple sclerosis. This is Dr. Kevin Windisch. If we can be of help, give us a call at our office, area code 775-359-7111. We'll see you around.